Hey guys, welcome back to Medical Coding with Blue. Today we're going to talk about my favorite topic, orthopedics. So here's the thing. There's a lot of confusion with a lot of people about global days and whether or not a patient should get a 99024 in the post-op or if they should get a regular E&M. So hopefully I can answer some of these questions today. So today's topic is understanding close treatment of like a fracture versus splinting. Okay, splinting, strapping, buddy taping. Okay. So I made little notes so that I can keep my thoughts organized in this one because otherwise I'll just go everywhere. So when a patient has a fracture, okay, this is all I'm talking about today is fractures. Okay, I'm not talking about injuries, just fractures. Okay. When the patient has a fracture, the treatment does not always constitute a global period, okay? There are some things that a provider can do for a patient that is not going to automatically put them in a global period, like a 90-day global period, okay? Some fractures are treated with buddy taping, splinting, or a sling on the initial visit, or a strapping, okay? These are not global service procedures. Sometimes these are included in the E&M, therefore you would not pick it up in addition to, i.e. like the buddy taping, okay? So it's very important to look at what procedure that they're having, and that's going to determine, like on your subsequent visits, whether they're going to get 99024 or whether they're going to get a regular evaluation and management code, okay? Some examples of fractures that are mistakenly coded with 99024 on subsequent visits, because like their treatment is like a strapping or buddy taping or a sling. Some of these are like the finger fractures, toe fractures, clavicle fractures, and rib fractures. Now, unless they actually go in and have a surgery for like rib fractures, there's really not a whole lot they can do for a rib fracture, okay? And unless it's going to like puncture the lung, then of course they've got to go take them to the OR, But other than that, most times when people have rib fractures, they just basically have to sort of like brace themselves, And there's not really a whole lot they can do. They just have to let it like heal on its own. I've had one broken bone before, which was my rib, and I broke my rib because I'm an asthmatic and I coughed really hard and I didn't have a chance to, like, I had an asthma attack, right? So it just came on like all of a sudden and I just completely blew out a rib. So it was very painful. I missed conference because of it, and this was a few years ago when I missed LA. I missed the LA conference. Not that I really wanted to go to LA, but I don't mind. It's just that it's just so big. LA is just so big. But that year I had the fracture. I was just like, I cannot go. And I was like, oh my gosh, I was in so much pain. Like literally when I was at work, I was like inching down the hall, like trying to get to the printer or trying to get to the bathroom or whatever. And it was so miserable. And like everybody that I work with was like not used to seeing me just hobble down the hallway. But it's not fun. It's not a good time if you ever have a rib fracture. So if you have one, I'm sorry. I know your pain. So, but moving right along. So I put on here on my notes, look at the initial treatment, okay? Is it just to stabilize a fracture? An example of this would be like ER physicians who just stabilize, and it is permissible to code their evaluation and management level as appropriate with a 25 modifier appended to that E&M, along with the appropriate strapping or sling code. Okay, so again, you're going to have to pay attention to what are the global days on this particular procedure. Now, I was requested to do a back to the basics, do those videos again. So what I want to do is compare the CPT Professional and the CPT Expert book, because the CPT Expert gives the global days. And I'll show you in the book when I do the back to the basics here in a little bit what I mean when I say that, because The encoder will also tell you how many global days are on a procedure too. But if you have the book, the CPT Expert Edition is going to be able to tell you what the global days are. Okay, so like I said, I'll show you all that in a little bit. If a patient is put into a cam boot, okay, and this is a huge thing, I see this all the time. If the patient is put into a cam boot, this is not closed treatment. Okay, this is not closed treatment. This is a boot. It would be like, basically like if they were doing a strapping, right? But they're just giving a patient a boot. They're putting a boot on them. This is not closed treatment, okay? The provider is getting credit when issuing this cam boot because the cam boot has a HCPCS code, okay? You can find it in the HCPCS book, the HCPCS book, okay? That's where you're going to find that particular cam boot, okay? There's, like I said, closed treatment is something completely different. You'll have to read the description of the closed treatment for like a toe or whatever. If you're wanting to code that, read the description, okay? But if they're issuing a boot and they're not doing anything but giving the boot's already covered under that HCPCS code, okay? Something to know. And on those subsequent visits, when the provider is just putting the patient in a cam boot, just say for instance they fracture their toe and they just put them in a cam boot, okay? On those subsequent visits, you're still going to carry that fractured toe code with the D because the patient's in the healing phase, but it's going to be a regular evaluation and management code. It is not going to be 99024, okay? Because that cam boot does not have a 90-day global attached to it, okay? It is a boot. So this is something to know. If you get confused in the beginning, it's understandable because this does happen in the beginning, especially when you're coding for orthopedics, podiatry, or the ER, okay? These are things that happen most often in there. Sometimes like primary care will get some of that too as well. But it's mostly in the specialty clinics like orthopedics and podiatry and the ER. So just make sure that you are aware and looking at the documentation and seeing what the provider did, okay? But like I said, if they are issued a cam boot, it is not a closed treatment. A cam boot is a boot. All right? Let's see, what else? Okay, it is important to understand what is involved in closed treatments and or reductions, okay? Because there's closed treatment and then there's reduction or manipulation, okay? So sometimes you'll see the entries in the book where they'll have like closed treatment without any kind of manipulation or reduction. And then you'll see closed treatment with reduction or manipulation, okay? So make sure that you look at that and look at the documentation. Using traction, that's where they're manipulating and making sure they're reducing it in the correct position. So know the difference between the two. Look at the provider's documentation, what they've documented, and then if you need to, use your coder desk reference for procedures, okay, or look it up in the encoder, the layman's terms for what this procedure entails, okay? And when they sort of match up, that's what you're looking for, okay? But keep an eye out for procedures that are marked as with manipulation, with reduction, okay? Or with traction. Make sure that you're looking for those words because there's a difference between a closed treatment with no manipulation and then a fracture treatment with the manipulation or reduction. Okay? It's those words you gotta look for. All right? So, again, the CPT Expert Edition will have the global days in it. So that way you can look and see, what the global days are. 90-day global procedures will carry 99024 as the procedure code on the subsequent visits throughout the 90 days. Remember that the global package starts one day before the surgery, the day of surgery, and the 90 days thereafter. You will also apply any recastings, splint applications, or slings during this time. So a lot of times when a patient, breaks their bone and then they do the closed treatment or they do the treatment with manipulation, Okay, that procedure has a 90-day global on it. Okay, even though they don't go to the OR, and this throws some people off. There's no OR time. It is the procedure. The procedure is telling us that it has this many global days attached to this procedure, okay? So when it does have those global days attached to it, and they do the initial casting, you know, you don't use the supply codes, okay, on the initial casting, okay? But on the subsequent visits, when they take off the cast, they may apply like a splint. They may apply just a sling, depending on what bone was broken, okay? And you can pick up those codes, you know, those for the sling or for the strapping or the splint application, okay? You can pick those up, okay, because it's in the subsequent visits, okay? This is still going to be 99024, okay, because it is all during that time. Now, if, let's just say the same patient who broke their toe and they got put into a cam boot, okay, let's say they did that, the cam boot. On the subsequent visits, remember, you're going to get an evaluation and management because there's no global days attached to that cam boot. All right? But you're still going to continue to use that fracture code with the D, you know, at the end because they're still in that healing phase, okay, until it is no more, or you know, they are not seeing the provider anymore, okay? And then if they come back like 6 months later on a follow-up and they're checking them out, making sure everything's okay and there's no sign of a fracture anymore, everything's healed, then it would be the Z09 for the diagnosis code, which is a follow-up after completed treatment, and then a history of fracture code, okay? Because we're talking about fractures, because there's a history of fracture, there's a history of injury. So that's something to look at in those diagnosis sections, okay? Check those out because the diagnosis can get pretty detailed. Just have to make sure that you're looking at all of them. So I hope this clears up some things. So when you're working with fractures, it's not always going to be, oh, this patient had a fracture, so they're automatically going to go in a 90-day global. Look at what they got treated for. Look at how they got treated is what I meant to say. Like, did they use buddy taping? Did they use splint? Did they use strapping? Those do not have global days attached to them. Okay, so if that's all they did, then it would be the evaluation, okay, along with the strapping or the splinting, okay? You can, and on the initial visits, you can get the evaluation and management with a 25 modifier on it. For those that have a zero day globals on them, you can get a 25 modifier on that evaluation and management. Now, if it's a 90-day global procedure, like they're actually doing closed treatment or they're doing a reduction, then you're looking at the 57 modifier on your evaluation and management because that is decision for surgery. Okay? Yeah. I will eventually do an exercise where I'm showing you, like, you know, how it's like a good example of walking through it. I did it before, but like I said in another video, somebody complained that they couldn't hear me. So I guess I'll have to make sure that I talk louder because, again, I am not technologically advanced, so I'm just using my voice. Anyway, but yes, I'll go ahead and close this video out, and I will be shooting the back to the basics, showing you guys the difference between the CPT professional and the CPT expert, okay, where all the procedures are housed. All right? So I will go ahead and close this out. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!